Alright, so we've been trying to look at a lot of enzymes since we started looking at proteins. Proteins which proteins which are tumor markers. So under the proteins which are tumor markers, we have the enzymes, then we have the hormones. You understand? So under the enzymes, we are looking at the types, right? So we are looking at the alkaline phosphatase, right? Then we are looking at the creatine kinase. We are looking at the lactate dehydrogenase. So there are other enzymes, but we are just looking at these three first, So look at them as tumor markers. That's basically trying to state, of course, that means if there's a particular tumor that involves them to be on the rise, right? So I'm now trying to list the tumors that I should be expecting to see these things on the rise. If you see these things on the rise, the tumor that I should be suspecting. So for alkaline phosphatase, it's usually involved in bone metastasis or liver metastasis, right? Bone metastasis. This is an image showing alkaline phosphatase involvement. So bone or liver metastasis. So you have a cancer somewhere, it's going to the bone, or maybe you have a primary cancer in the bone, So Regan isoenzyme, like the placental alkaline phosphatase, is elevated in malignancies like ovarian cancer, lung cancer, trophoblastic, and gastrointestinal cancers. Okay. Therefore, lactate dehydrogenase. Lactate dehydrogenase is a glycolytic enzyme. Is released following cell damage. So usually tumors that primarily utilize glycolysis rather than aerobic respiration for their energy requirements. Alright, so it's elevated in many large tumors, including tumors of the breast, tumors of the colon, stomach tumors. Right, so you can also find it being elevated in lymphomas, being elevated in leukemias, being elevated in neuroblastomas. Right, all these are possible cancers where you can actually find lactate dehydrogenase assays on the high side. The creatine kinase. Creatine kinase has a lot of isoenzymes. We have the CKMM, which is basically for the muscles, We have the CKBB, that's for the brain. We have the CKMB, that's a myocardiac band. You understand? So occasionally, the creatine kinase is elevated in tumors such as prostate cancers, small cell carcinoma of the lungs. Alright, so usually the BB isoenzyme is the one elevated in those cancers we listed. Alright, so many cause elevation in false elevation in CKMB levels, right, in some certain CKMB assays, right? But CKMB, of course, is a cardiac marker, not really a tumor marker.